Good evening, everyone. Hey, Lauren, how you doing?
Hey there. Hi, Wen. How are you?
Good. Happy fall. Hey, we got John Liu and Lindsay. We got faculty before most fellows. That's fantastic. I
Evening,
haven't set
everyone. Hey.
anything up, John or Lindsay. So who you guys can flip a coin or do whatever you want in terms of who goes first and all that jazz.
I mean, I'll leave it up to Lindsay. I think I have something I can upload and start the discussion if you'd like, or Lindsay, if
Mhm.
you want to start, it's up to you. You want to do?
It could go either way. So I have a PowerPoint,
Okay.
whatever Wen thinks is best from an organizational
Yeah, so
standpoint.
I get to pick. Well,
Uh,
let's have Lindsay you go first and then John will follow. And we'll do, like 20, 30 minutes for you, Lindsay. And we definitely have to leave time at the end for some
For
questions.
questions,
Maybe,
absolutely.
yeah, 25 minutes for you, Lindsay, and then same for you, John.
Great.
You have the screen can share if we want to upload something, correct?
Yeah, yeah, absolutely. Yeah, yeah.
Okay,
I think Lauren is the host, but Lauren, you can
great.
be the co-host if you would like.
Okay, great.
And we'll let some people kind of um, filter in. It's
Mhm.
different time zones and other things. And so people probably have different responsibilities or coming out of the OR or whatever.
This is nice. All these familiar faces. I remember interviewing a lot virtually. It's
Yeah,
good to see
exactly.
everyone again.
Yeah, it's great.
Yeah, yeah.
All right. We'll give them, what are our numbers here? 17. Let's wait till we get to 20 and then we can probably get started. And I'll do a quick intro, Lindsay and John, and then we can get cracking after that.
Sounds good.
It's just 7:30 now. Oh, now I'm the host. Okay, cool, cool. All right.
Yeah, sorry, I'm just gonna turn my screen off because I just got done in the OR. I'm in California, so it's a
Oh,
little
cool.
earlier here.
Do it. Do it. All right, we hit 20, but let's see. It's still pretty early. Let's give people another minute or two. All right.
How's everything up in New York?
Oh, it's great, John. Thank you.
Yeah.
Nice
It's
to.
fall, right? The weather
Not
coming
really.
nice
No,
up
no,
there?
no, no.
No.
It's still like it's still kind of warmish, and yeah, I think leaves are a little bit later. So yeah, not quite. But yeah, so excited and um, definitely it's it's that I still find myself like I hear when I introduce myself like hey da 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 Wenchen UCSF. No, it's past couple months. Oh, we got Travis on. That's great. Hey Travis, what's up, man?
Hey,
Looks
Wayne,
like
how
you're
are you?
looks like you're at a sporting event. If oh no, you're just at yeah, you're
No,
at like
yeah, sporting event. I'm at my son's football practice.
oh cool. I love it. Well,
Uh,
thanks for your dedication and for hopping on. I love it.
Thanks for having me.
All right, cool. All right, I think we should probably get started because I want to give a lot of time for Lindsay and John to be able to do their thing. So, welcome everyone. This is the first ESU webinar of this academic year. And the first thing to say is congratulations on getting this far and for, surviving your first month of fellowship. And congratulations on being a part of this awesome profession of endocrine surgery, but also this awesome organization of the AAES. And so my name is Wen Shen. I'm endocrine surgeon at NYU, but also the director of Endocrine Surgery University. And the object of Endocrine Surgery University is really to provide kind of a framework for your educational experience for this entire fellowship year, but then also to really get you set up so that you can become a happy and productive member of the AAES and of the endocrine surgery community. And so the kind of overall objectives of the of the ESU experience are multifold, right? It's basically educational, but it's also professional development. It's kind of interpersonal. It's getting you integrated into the endocrine surgery world so that you can be the best endocrine surgeon out there in the world that you can be. And so throughout this year, we'll do some intermittent webinars, usually every other month kind of thing. And then everything culminates with the in-person Endocrine Surgery University, which precedes the annual AAES meeting, which will be next April in Lexington. And it's a 2-day kind of finishing school with some didactic and interactive panel sessions. There's hands-on ultrasound, there's some professional development time, and a lot of social time with the Endocrine Surgery University faculty, but also some of the AAES leadership, and also for you all to be together and to bond, because your class is your class, and you guys will be bonded for life as class of 26 ESU. And so all these things are to say that it's an exciting opportunity to fill in your fellowship experience and to bring you into the endocrine surgery world. So for this first webinar, traditionally we've done this because it's early in the year, but believe it or not, it's time to kind of think about and start acting upon this, is finding and negotiating your endocrine surgery job, which is going to be the objective, that at the end of this year that you will have something lined up that will allow you to start and really develop your endocrine surgery career. So we've got two outstanding speakers, Dr. Lindsay Kuo and Dr. John Liu, both of whom have firsthand experience in kind of creating a template for this finding and negotiating process, because they wrote the AAES white paper. They were two of the co-authors on the AAES white paper, which it was on this exact subject. So without further ado, I'm going to turn it over to Lindsay to start, and then we'll go about 20, 25 minutes with her, and then have John go, and then we'll leave time for questions for both of them and for me at the end of this. So start thinking about things you want to ask, and then let's start with Lindsay.
All right. Thank you so much, Wen, for the invitation to speak. I do have slides. I know you're like co-host now. Is there a way for me
But I
to?
think you can share, right? Can you?
Yeah, looks like I can. Okay, great. So I'll get to the slides in a moment, and I'll go to the slideshow. I've been giving this talk a few years now in a row because I wrote the white paper that Dr. Shen referenced earlier when I was a fellow. And I found the process of finding a job to be really, really, really challenging. I'll get into my sort of personal circumstances as we talk a little bit throughout my slides, but I found it to be really challenging in that there was no guide to how I should go about this, or the timeline, or what I should do and what I should say and what I should expect. And I ended up writing the white paper with Dr. Liu, who provided some faculty and experience perspective. And that was really helpful as well for me to, again, learn more and more about the process. So I've been honored to kind of give this presentation a few years in a row now, because I think it's just such a critical part of what we've all come to do is ultimately be surgeons. And nobody really gives you a guide for how to do that beyond how to operate really well and take care of patients. So that was the genesis of the white paper, and that's sort of the basis of what we're going to discuss here. And so I have no disclosures, and a lot of this is just really built through my own experience. And we're going to talk about finding your first job, negotiating it, and figuring out, is this the right job for me? And so a little bit of a backstory is that when I was a fellow, I was a resident in Philadelphia. I went up to Boston to be a fellow, and my husband's job was still in Philadelphia, and it still is in Philadelphia. And so I needed to come back to Philadelphia, and there were no available jobs. This was 8 years ago, and like the endocrine surgery job market was in sort of like a low point. In terms of how many jobs were even being advertised for primarily endocrine surgeons. And so I really had to find my own job. And I don't say create it because I obviously didn't create a job for myself, but I really had to seek out the opportunity to give somebody the chance to hire me. And it was unexpectedly really challenging. And I really thought it'd be just like, who wouldn't want to hire me because I am really good at this. But it was really hard. So finding your job is really easier said than done. And I think a lot of this is really focusing first on you guys taking some time now to figure out what it is that you really, really, really want. And so much of what you've been doing in the last, few decades has been figuring out, okay, well, I want to go to medical school. I want to go to residency. I want to be an endocrine surgeon. And then the choices are sort of in some ways made for you because of the match or the limited options that are available to you. And the beauty of the place that you guys are in now, which is that there are really limitless options. There's not, 20 endocrine surgery programs that you apply into. You could apply to any number of jobs at any number of hospitals across the whole country. And you can do anything that you want. You can do mostly endocrine surgery. You can do a little bit of endocrine surgery. You can do no endocrine surgery. And it gives you just so many options to figure out what it is that like you really want, that you are really looking for. And again, we've been working for so long, you guys have been working for so long in this world of very limited choices that this is actually, again, a little bit more daunting and requires perhaps a little bit more thought than you've really needed to put into anything before when you haven't had choices available to you. So think about what you really want. And the first one is geography. Statistically speaking, most of you are probably have families, and geography may play a role in you figuring out where you want it, like where you want to be practicing. Where do you live? Where do you want to live? Where are your parents? Where are your spouse's parents if you're married? If you have kids, do you really want to make sure you're around some family members to help out with childcare? Or is that just how you want to grow up, is really close to your family? Or maybe you really don't care. Or maybe, you went to college in a certain place and you want to go back there, and that is where you want to live. And you need to think firstly about physically geography. And maybe that's not important to you at all. We'll get to that. What kind of job do you want to have? The pillars of academic or community-based are sort of, merging a little bit. They're a little bit less clear because there are jobs that are, more academic that have some research component or teaching opportunity that exist in a non-academic center. And there are jobs that are in academic centers where there really is no like research component per se. But you need to think about really what type of job do you want to have? Do you want to work for a university? Do you want to work for a health system that maybe is not affiliated with a university? Do you want to work for a practice that increasingly there are fewer and fewer totally independent practices, but they are out there. So where do you want to work? What kind of setting do you want to be in? Who do you want to have as your colleagues? What are some of the clinical priorities of yours? And by that, I mean, do you want to have the opportunity to do a lot of RFA? And do they already have an RFA program, or would that be something that you would have to set up? Do you want to do, like I mentioned earlier, any general surgery, no general surgery, etc.? Those are the things to think about, like sort of the structure of your job and what you'd be doing on a daily basis. If you'd be going there, is there already, for example, a really well-established high volume adrenal surgeon who gets all the adrenal volume, and so you wouldn't get much of the adrenal volume? Something to consider. And then the last thing I have is other qualities, which is sort of a catch-all. And, I've created these categories, and by no means does that mean that these are like the only way one can think about these categories, but I think it's sort of a helpful framework. So other qualities about the job include things like research. Do you want to have protected time for research? Do you want to have a startup package? Do you want to just be able to do some health services research? And so as long as there is like a great mechanism by which you can do that, you'd be happy. Do you want to do no research? Mentorship. Not just like, okay, well, who's going to help me, in my career, but from a very specific standpoint, who's going to help you in the tough cases? Who are you going to call up when you have a patient and you're like, I don't know, what do I recommend to this patient, et cetera? And who are you going to call in the OR when you need something? What are your other non-clinical interests? Do you want to do a lot of education? Do you want to do quality related things, stuff like that? And then you have to figure out, what do you not want? What is not important to you? And then you kind of have to prioritize and put these things into a framework to figure out what it is that you want and how does that guide your search. And so for me, just as an example, geography was the most important thing to me because where my husband's job was and where he was. So that was paramount. Then some of the clinical specifics, I wanted to do endocrine only. I did not want to have a large general surgery component. It just was not what I wanted to do. And to some degree, the rest of it, the other clinical stuff, I didn't care as much about. What type of job? I would prefer if it was academic, but I would have taken at some point a job in Philadelphia that was minimal endocrine surgery and not academic, if that's what it meant to be back in Philadelphia. And the other qualities was really number 4. And I put this in contrast with one of Dr. Liu's partners, my good friend Josh Data. He was one of my co-chief residents at Penn. So same residency program, same graduation year. He is a surgical oncologist with a lot of external funding. And for him, and I know I've shown these slides before and he knows it. For him, he really wanted to be sort of doing academic only basically just pancreas surgery, HPB stuff. And the other qualities, he wanted like a big research startup package. And those are the most important things to him. And then geography was the least important. And so he took a really fantastic job where he has no family. And he and his family have really flourished there, and he's done really, really well. But again, you can see that one person's interests do not have to be the other person's interests. And you should really just, again, take heart that you may feel like you're going to compete with people for jobs, but what everyone is going to want is something a little bit different. Okay, so you have to go through this and prioritize what is important to you. And then you have to do some homework. Figure out what jobs are out there, and also to some degree, what jobs are not out there. So start by looking at job postings and job boards. I tried to get a screenshot of the AAS job board, but it featured like one job at the top, and there's no way for me to get a good screenshot. I didn't want to be featuring a specific job. So job boards, not just through the endocrine surgery job board website, but a lot of other societies or organizations will have job boards. So SAS has a job board, the AAS has a job board, and these are great places to sort of reach out and figure out what else might be out there. Again, if you're open to doing something that isn't purely endocrine, you may be able to turn another job that looks primarily at general surgery into an endocrine surgery job if other things are more important to you. Search hospital and medical school websites to figure out who's doing the cases there. Sometimes, and this was the case for me, and I think this is getting a little bit less common as the endocrine surgery world gets a little bit bigger. I'm at Temple, and there was no endocrine surgeon at Temple. There was an otolaryngologist who did thyroid parathyroid, and there are urologists who are still there who do some adrenal, not a lot. And so for me, I reached out to somebody I knew who was a resident, and I was like, hey, who's doing these cases? And he was like, oh, we double scrub with ENT. And so I was like, that's an opportunity for me to say, hi, you don't have an endocrine surgeon. I'd like to come be your endocrine surgeon. So that was not a job that was posted anywhere. And ask around, because sometimes, again, endocrine surgery is a small world. People will know of somebody leaving or who's about to leave. Did I freeze? No, I'm back now. Okay. People know of somebody who's leaving or who's about to leave, or of a job, somebody left a year ago and they had a change in their leadership. So they're just now getting around to posting the job. So these are all the things that you kind of need to do. You can't just expect that there's going to be like 15 jobs out there listed for you to just take your pick from, unlike, again, with every other process you've gone through before. And then reach out. So once you sort of figured out what the option, like what do you want, and to some degree that may have to change, and what is out there, then you have to start reaching out to people. Again, if there are job boards or jobs posted on a job board, there's usually like an HR type of person or a search person whose contact information is there, and you should absolutely go through that channel. But I don't think it hurts, and Dr. Lu can correct me if I'm wrong, and so can Dr. Shen. I don't think it hurts to also reach out to the division chief or the department chair to say, I am really interested in this. I am applying. I would love to chat with you. I will be at the Clinical Congress in Chicago in a month. If you have any time to meet, it may not go anywhere. But I think sending that initial email will be really helpful to try to, sort of establish a personal connection. And you can have your mentors do the same, again, if it sounds like there is a job that would really work well for you. If you meet up in person, you should definitely follow up with email later to just even close the loop, even if you realize it's not a position for you, because it is a small world. You don't want people thinking poorly of you. All right, so when you email people to say, hey, I'm interested in this job that may or may not exist, what should you say? And so here's a sort of drafted email template that I wrote. You want to be really brief because people don't have a lot of time to read things, and succinct. And this is what it said. It said, my name is this. This is what I do. I'm looking for a position in endocrine surgery to start in the fall of 2018. So for you guys, be the fall of 2026. And I said, this is my experience. This is what I think I can add. So again, really, really brief, just so they know who you are and why you are reaching out. I had a customized cover letter. Again, I didn't have to make too many changes, but I wanted to make it clear that I had done research into that institution and figured out why and how I would best fit into there. So I kind of expanded those previous paragraphs to talk about my training, to sell myself a little bit more, to go into more depth about my research or other experience, and what can I add. And so for me, I talked a lot about not only just doing the cases and teaching the residents that way, but also providing didactic education, doing health services research. And I really kind of sold the fact that endocrine surgery is a core component of a general surgery education. And that worked well for this institution that didn't have an endocrine surgeon. But again, be concise. And I had a CV also that was up to date. And then include just another Word document that has a few references in it, usually your program director from either your fellowship or your residency program or both, and any other significant mentors. And then again, include their name and contact information in a separate document. So you do all of that. And the question is, well, when should you be doing these things? And I'm really glad that Dr. Shen has this so early in the year. It feels really early, I know, but this is the time you should be doing all these things. It is September, October, so reaching out is still now. But you really need to be doing some soul searching right now because it's really hard to start this journey without figuring out what it is that you want. And then you should be doing some homework on the side, figuring out what programs there are available, or what programs may you try to create your own opportunity at, and getting all your documents together, asking your program directors, et cetera, if they can be a reference. And then start reaching out at the end of this month. The Clinical Congress, if you are going, is a great opportunity to meet chairs and division chiefs from a lot of other places. Again, they may not be there. They may not have the time for you, even if they are, but at least it's an opportunity that won't really come up again in the future for you to say, hey, I'm going to be at this meeting. And I think the really challenging part that I was not expecting or prepared for is that there's no timeline for response. You guys do, again, all the matches that you have go through and you hear back at a certain time period and you know when you're going to hear back and can make plans. And some programs may not respond at all. And nobody really prepared me for that. And so, not because I thought I would hear back from people right away, but I thought I would at least hear back from some people saying, we don't have a position open right now. I'm so sorry. Good luck with your search or something. A lot of people just never acknowledged my email. And that's when I would have a mentor or a faculty member at my institution or my previous institution reach out to somebody that they knew at that hospital to just sort of ask on the side, like in case it got filtered out. Hey, are you gonna, is there any chance you'd be hiring for this? I know somebody who's interested. Again, really, you can also send a polite follow-up email. You're gonna hear no a lot more than you're gonna hear yes. Most people, again, are not necessarily going to be willing to speak to a ton of people if they're not actually having a job or if they're like, oh, there's a whole hiring process. But it doesn't hurt to reach out. And then if you're really struggling, really then reconsider what your priorities are. Go back to step one. What would you be willing to give up? And so I didn't finalize my job until like June. And so this was a slow process, just to be clear. Like I started sending all these emails in September. I was just not getting feedback or anything. And then I came to Temple in February for an in-person interview after some emails. And then like the job wasn't going to be there, but then somebody left, and then so there was a job and an opportunity for me. And so I didn't get everything finalized until June. And so by that point, I had another interview with another hospital that no longer exists. And I would have had to do more general surgery, but I was like, I'd rather be in Philly than not. So that's when I sort of, again, reassessed my priorities and figured out what I would do. So once you get an interview, again, usually it's coordinated by a hiring office or HR or something like that. The first round is going to be really general. It may even be on Zoom these days. The second round will be more in-depth and more specific and in person. Do your homework, research the people in the place, talk to your mentors about what their endocrine surgery division at that hospital is like. What do they know about it? Because it's not going to good look if you show up and you're asking sort of basic or straightforward questions. Similarly, you should be prepared for the interview to talk about what would you add to the hospital? Are you willing to move there, etc. Bring all your materials that you had already emailed everyone, make sure they're updated, be able to hand them out to people. Some people are still old school and really loved some paper to touch and read and look at. And then consider drafting a vision plan or a career plan to show that you have some foresight, some thinking about what you would do next with your career. Okay. Really quickly onto negotiation, which will be pretty brief. Again, nobody really prepares you for any of this. So you have to figure out, how are you getting paid? There's a variety of payment structures and they differ a lot from hospital to hospital. Some are RVU based, some are sort of, here's a fixed amount and beyond that you make an RVU. Some are really only you kill what you eat or eat what you kill. Everything is different. And I think some of the challenges that your current mentors may have experience in sort of what their contracts look like and won't be able to anticipate what another institution's contract structure is. There is usually a fixed period of a guaranteed salary for a few years, as they're expecting you to grow, which is always encouraging. But you should figure out once you get a contract offer, what's happening. Go review it with somebody. For a lot of the big institutions, like the big health systems, the big hospitals, you won't be able to really change the fundamental structure. So for me, my contract is sort of, here's a set amount, and if you exceed a certain amount of RVUs, you get more. And in theory, if you really don't hit that RVU target, we could fire you. I don't think they actually do that, but that's how my contract is set out. I'm not going to be able to go to them and say, look, I want to be entirely RVU based. They're not going to change how they pay people for me. So you're not going to be able to change that, but you should figure out what some metrics for success are so that you're not being held to some standard that is unachievable. You should make sure you have block time in the OR because I think it's really hard to be a busy surgeon or to build a practice if you don't have OR time. And what's your clinic time? And are these things reasonable? So again, when they started, they told me my target was to have like 4 half days of clinic a week and to be seeing 50 patients total a week. And I was like, where where are you getting all these people from? They just had no idea what an endocrine surgery practice is like, and it's a work in progress to get them to like let go of some of these things. But you want to make sure you have the appropriate time and resources for all these things. So, again, push back gently. Just say like, this is not, endocrine surgery practices like this instead. What are your resources? Who's going to be your administrative assistant? And you're probably going to be sharing them with at least one other person. Well, is there an APP? Or a nurse or a medical assistant who's going to be helping you with some of these things, like calling patients back in the middle of the day, filling out paperwork, etc. And what are some thresholds at which you might be eligible for more resources, more OR time, an APP if you don't have one, etc. And then talk to a lot of other people. This is something that people find really taboo in a lot of ways because nobody wants to talk about how much money they make. But I think it's actually refreshing to realize two things. Like, it's not a competition. You want your friends to be successful. You want to be successful. Having more information about what people are doing at other institutions is really helpful. I think it's really hard to know if you're being overpaid, underpaid, paid appropriately. There's no good national metric data on payment and RVUs and stuff just because there's not enough endocrine surgeons that get reported. So the data out there is really limited, and I wouldn't really trust that as much as it might be tempting. But talk to other people and see what they're getting paid. How are they getting paid? What are their expectations? Sometimes a fit is not going to be great, and that's going to be helpful for you to understand again, what you're experiencing abnormal, or is it just some growing pains? Other things to consider as you're talking about job stuff: who's going to be your clinical backup? Is it another endocrine surgeon? Is it somebody else? What research resources are there if that's what you're planning on doing? How is call structured? And again, who's going to be your mentor? Who's going to help you? Ask yourself some really tough questions throughout all of this. Like, what is it that you really, really, really want? What do you need to have? And what else did you learn about what your priorities are in life? And that's really it. Good luck.
Whew, that was a tour de force, Lindsay. So thank you for sharing. Definitely, we will have time for the fellows to ask you questions, but I wanted to turn it over to John to give him the chance to talk. John Luke.
Great. Great. I'm going to upload my presentation here. I don't know if you can see it. Can you see it now? Great. That was a really wonderful discussion and presentation by Lindsay, and I think you've covered really the really important things to sort of consider as a fellow. My presentation will probably overlap a lot of what Lindsay had mentioned, but it really comes from also integrating some information and experience from being a fellowship director for 20 years and helping my fellows get jobs. So I'll integrate some of that also along with my presentation. So with that, you picked a life to be an endocrine surgeon. And so again, with some of the things that Lindsay kind of mentioned, you really want to sort of consider what kind of career you want. You want to take into consideration work-life integration and decide what kind of pathway you wish to pursue. There are different, I would say, three basic practice patterns out there. There's the classic historical academic triple threat model, where you're involved with clinical practice, research, and education. There's this hybrid model, sometimes sort of referred to as academic light or prefectemic, where you are associated with a academic center, but and you do have clinical practice, but you also do some education in terms of like training residents and medical students, but you're not really involved with research. And then there's the traditional private practice or community model. And I'd say that these are probably the three kind of practice models out there right now, currently in the United States. There was a saying when I was going through training and everything, and a lot of my mentors were telling me is that it was always easier to go academic to private than to private to academic. So, you want to think about what kind of practice you want to have in the future after you finish your fellowship training, and that may help you in terms of choosing a career and what path you wish to pursue. So this is kind of like the process. And sort of think of it this way when you're starting to go through the whole process of trying to get a job. And again, I think it's great that Wen is sort of starting out the year this way because I think it's never too early to start looking and considering a job. You want to sort of decide personally, and I think Lindsay stressed this, you sort of have to sort of think about really hard what you want to do. Do you want to go into academic? Do you want to go into community? Do you maybe want to do something else, like go into industry? You want to sort of set these goals in your mind, and then also consider other personal things in your life, your family, right? It's very important to make sure that your family is on board. You're not just thinking about yourself, but you're thinking about your family. You're going to be thinking about location. Geography is very important, especially when you're finished your training. And again, Lindsay also kind of stressed that in her presentation. Proximity to in-laws, family, things like that. These are very important things that also are things to take into strong consideration when you're looking at your first job. Then you need to, after you've sort of made those personal decisions in terms of what you want to do, then the next step is to really like start looking at opportunities, looking for job positions and things like that. One is the AS website, the ACS website, the SSO, the SSA, the Society of Academic Aging Surgeons. But I will tell you that a lot of times those jobs are already taken. Sometimes um, candidates are already kind of been selected, but because of things like equal opportunity, things like that, they post these things. There are some opportunities where you can actually apply for the job and the job will still be available. So you just have to go out and sort of see if and apply for the jobs, but be sort of aware that sometimes these jobs have already been offered. You want to make contacts. You should really talk to your fellowship director, all of your fellowship directors. Your fellowship directors can really help you with the job search. You may also want to, contact your former, general surgery residency faculty as well. They may actually have some contacts as well. And so you want to think about sort of setting up all these networks and bringing in people from your past that may be able to help you sort of set up a career opportunity. You want to make positive first impressions. And again, you want to make sure you prepare a cover letter and have an updated CV. And then after you apply and get some offers, then you're going to start, or first of all, some offers or to interview. You want to make sure that you go through the process. You want to make sure that interview with these places. It's a two-way street. You're going to sort of have to feel them out to see what they want, what they have to offer you. And you want to make sure that you can present yourself and make sure that you're presenting them with some information about yourself that you can offer to their position. And then after being offered a position, you want to evaluate it. You want to look into it. You want to see if there are things that you can improve upon. You're going to always have some wants, some non-negotiables that you really need, and there are other things that are not maybe that so important to you that you're willing to give up. And once you finally negotiate that final position, you want to seal the deal. So this is kind of like the process. Now, before I just want to make the disclosure that the current outlook right now in 2025-26 is very mid, as my kids would say. And I would make the disclaimer here that I'm not an economist, but employment outlook after 20 years of looking is often delayed and volatile. And right now we're going through this whole situation the past year where there's been a continuing shift in healthcare delivery and economics. We've seen federal budget cuts, NIH grants have been cut, VAs have been cut, state universities. And Wen probably knows this better than anybody from California, but it's just a very interesting market right now. There have been some hiring freezes, some have been warmed up, and I see that it's very regional. In the southeast here down in Florida, um, we've kind of weathered it pretty well. We haven't really seen so many significant hiring freezes. We've still hired some people actually the past year here. But I do know, and talking to other people around the country, that some institutions still have some freezes, and it's very variable throughout the country. But it might be challenging, but you should always remember, patients still get sick and need care. Health systems continue to grow. We've seen that down here in Florida, actually. Clinical and outcomes research still has become more sexy and accepted. You don't have to be a basic scientist anymore. And really, if you're flexible and you're adaptable, you will be rewarded. So I think there's still really a lot of opportunities out there. So getting ready, your ideal job. You got to sort of, again, go back to sort of thinking what your ideal job is. What are your talents? Where do you want to take your talents? What your desire and what your needs are. And when you think about it, will institution or the practice pattern support it? Would it be, will you get that at a community hospital? Will it be at an academic institution? Will it be something that you'll be able to do? And is it achievable? And perhaps more importantly, if you are going to go out there and be a practicing surgeon, are you going to be able to capture, quote, a market share? Okay. You got to define what kind of practice you want. Again, do you want a clinical practice with some research or education focus? Is it going to be in a big or small community practice? Again, there's these different practice patterns out there. And again, geography is coming back up here very again. Location, your family, what kind of lifestyle you want. These are all very important things to consider. And it's important to be flexible. Again, you're going to have some things in your mind. And as Lindsay alluded to, you have some must-haves in your situation. And then there's other things that you can sort of deal without, would be nice to have, but not essential. Okay. When you're thinking about your ideal job. Special considerations, two career couples. Many of you have, a significant other that has a significant job. You may be both doctors who will compromise, whose career is a priority. How are you going to do it? If you have children, that's another thing to take into consideration. And in some institution or practices may be very supportive, maybe give you some support. Others, you're on your own. And, as you know, any contingent plans need to be made, especially when you have children, right? My wife and I just became empty nesters. That's why I'm putting the picture up, so I apologize in advance. Family leave, you may want to, you're thinking about getting your job and then starting a family. And obviously, there's some institutions that will support that. Others may not have that kind of support system, but that's something you want to take into consideration. I find that a lot of junior faculty want to start their families, and so in some institutions, there's a lot of benefits to gaining a job there. And it's very important. Don't be asked to be afraid to ask for any arrangement or accommodations when you're thinking about landing a job somewhere. So the other thing is you want to sort of observe, talk to role models, mentors. Again, talk to your fellowship director. Your fellowship director actually could be a source of a lot of information, be very helpful. Talk to former general surgery faculty. There's this idea of mosaic mentorship. You want to develop context and references, very important. You want to tap into networks. Talk to former fellows from your fellowship program. They can be a really great source of information. They can tell you, what they did. Like Lindsay went through the whole process, and really her experience has been so valuable, and she's been able to share this with all the fellows subsequently. Know your personal goals and priorities, and again, be realistic too. So creating opportunities, what kind of things do you bring to the table here? Job skills, excellence does matter. Are you someone, you have specific directions, maybe you want to be a specialist, you want to be an endocrine surgeon, but the job may require you to be a general surgeon for a while, right? Do you have those general surgery skills? Are you able to work independently? Do you feel comfortable starting out, maybe doing some general surgery and then moving to endocrine surgery or whatnot? But again, your job skills are going to be very important. What you've gained and learned from your fellowship still matters very much. Do you have executive leadership and career skills? These are things that are also important to bring to the table, right? Do you have good public speaking skills? Do you write papers? Do you know how to run a service? Are you good with budgets? This kind of information you bring to the table is very helpful, especially if you're starting a practice. If you're in a situation where you're hired at a community practice and they're willing, they want to support you in terms of building an endocrine service line. Do you have that experience to be able to do things like that? General life skills are very important too. Setting priorities, time management, having that emotional intelligence, being able to work with people. These are important things that I know that I certainly look for, others certainly look for when we're hiring, junior faculty. And then the other thing is connections and networking. This is where you can bring a lot of yourself to the connections and to people and into networking. We've moved past test scores, where you went to school. We're really now entering the real world here, right? We have to think about personal and professional relationships. These things matter. Making these connections matter. These things will help you, and they'll help you maybe gain that opportunity. So these are things to think about. Again, your cover letter and CV, and again, Lindsay alluded to this, and I'm going to say the same thing. I think you want to be honest and list your accomplishments. You want your CV and your letter to have perfect grammar, no typos, the Queen's English, please. Your cover letter should be customized to each job inquiry. You want to, sort of customize it to the person, the institution. You should try to maybe make a statement of your clinical research or education interests. Your cover letter supplements your CV, who you are, what your passions are. And you want to let them know about yourself a little bit, like you're board certified and maybe you have a lot of research interests, a number of publications, what your interests are. And then obviously you want to update and polish your CV. You want maybe review it with your fellowship director or your mentor. You should include things like your education, your training, your leadership, your service, things like that. If you have any publications, of course, put them down. And your presentations at local, national, and international meetings should also be included. So networking, that means like calls, emails, going to meetings. And again, this is kind of the same thing that overlaps with Lindsay's presentation. You want to network, right? You want to meet people. You want to let them know who you are. You can do the advertisements, the websites and things, but like I said, a lot of times those jobs tend to be already filled. If you're thinking about like community programs, perhaps, I think headhunters probably are very useful. They can find you positions at community hospitals in a certain region of the country. Less likely are they going to be pure 100% endocrine surgery jobs. They're more going to be general surgery jobs with the possibility you can sort of negotiate that you'd like to build in a endocrine service line. And a lot of these community hospitals, believe it or not, sort of look into the idea of having an endocrine surgery line, and a lot of them feel that it's a service line willing to support. And so a lot of people that and some of my fellows in the past that have taken community jobs have been able to actually sort of negotiate some support to develop a endocrine service line. And so that's another way you can sort of establish a practice line. Again, these are more clinical, less education and research emphasis. But the advantages of a lot of these jobs is that they're usually in a location close to family and such, and there's the advantage there. Again, it's very important to be assertive and proactive. Again, really send out letters, try to establish contacts, be visible at national meetings. Always, it's okay to ask for help. It's important to get noticed, be creative, and be positive. So you go on, you do all these things, and you get an interview. People are interested in you. So with these interviews in hand, what do? Well, you want to obviously do your research, right? You want to gather and process all the information you have beforehand. Google searches, PubMed searches about certain faculty member there, maybe talk to certain faculty there, talk to trainees from that program. All of these things can be very helpful to learn more about the place. You want to practice interviewing, professional demeanor. A lot of times we do a lot of virtual interviews now. And then later, when we are a little bit more serious, we ask you to come face to face. So you want to be comfortable about, interviewing. Show humble confidence and passion in what you do. Very important. Okay. And then also be ready to ask some insightful questions. You may want to ask about some of the research they do there, or perhaps, does the do they follow guideline practice, ATA guidelines, for instance? What's like living in the area? Okay, these are questions you sort of want to have prepared and ready to go. You want to be articulate in the skillful manner of an endocrine surgeon. What you offer this position and institution, both professionally and personally, and maybe they're going to want to know if you're a team player. Are you a transformative leader? These are things that you want to be able to sort of show them, right? Put on the table. This is what you offer their practice. Gathering information and processing information. Again, it takes a lot of this, like looking at the pros and cons of the job. Do you and the job have similar goals? Does the division perhaps at the institution have similar goals? What are the definitions of success when you talk to the division chief or the chair of the department? What is the definition of success here? Do you think you can grow professionally in this position? Will you and your family be happy there after 5, 10, 20 years, right? So these are things to sort of think about. Are you excited or indifferent about the position when you interview there? Do you get a good, warm, fuzzy feeling about it, or are you just kind of like really indifferent about it, right? These are all things to sort of think and feel about. Question is again, what do you want? What does the other side want? This is all from dealing with the institution after the interview and maybe the offer that they give you. And you want to look at the offer. Will you grow in their practice? Then you start asking about, well, what are things that you must have? What are you willing to give up, right? This is where you start thinking about the negotiation. Um, you may have more than one offer. And if that is the case, which is really great, then you can sort of see what the offers offer you and which one do you think will give you the best package, quote unquote. Remember, everything is negotiable, right? I remember someone once telling me, ask. The worst thing that can happen is they can say no. So this is the, period of this whole process where you can ask for things, perhaps, something that you think is really important to you. You should have a strategy in terms of what you wish to gain and which you are willing to give up. These are just some summary of things that I think we touched on. I sort of break it up into like personal and financial things and work environment. So there are different, compensation-based salary plans. A lot of academic centers, they've sort of transitioned to this work RBU system, and I think the white paper sort of discusses it kind of nicely to give you more information about it. But there's also this compensation plan in some community practices where it's a buy-in, right? They first few years they kind of subsidize you, and then you sort of become a partner to the practice, and then you basically pay them back, believe it or not, and then you eat what you kill. There are many different compensation plans out there. The one that's kind of the most common one in a lot of the academic institutions and probably in the hybrid programs is this RBU system. And then a lot of times when you're talking about negotiating a plan, they give you an incentive plan. This is like they give you like a benchmark of how many RVUs they expect a year. And Lindsay kind of mentioned to you that in endocrine surgery, we really don't have standard RVUs per year. And a lot of times it's extrapolated from general surgery, surg-onc, or breast. But some programs, what they'll do is they'll give you in a contract a benchmark RVU to achieve the first year, second year, right? And then if you go over that, you're part of their incentive plan or their bonus, and then they compensate you more additionally for every RVU you do over the benchmark. A lot of places have great benefits. Things like retirement plans, matching, health insurance, parking, licensing, tuition remission. This is my second year, I'm really appreciating it. And what that is one of the benefits at some of the institutions, more specifically academic institutions, is that they will offer you 100% tuition remission if you send one of your kids to a university anywhere in the United States. Some other places are more select. I know my colleagues at Vanderbilt say that Vanderbilt will pay 100% tuition of your child if they attend Vanderbilt, but nowhere else. I have a colleague at Yale that says it's about a 50% remission, right? Everybody has a different tuition remission plan, but that's, I think, one of the great benefits for to sort of consider negotiate, especially if you have a family. We call it the golden handcuffs, because once you have a benefit like that, you never leave the institution, right? Because it's such a great benefit. Malpractice insurance and tail. Many places will cover your malpractice. A tail is when you leave service at an institution. Some of them will hold on a 6-year tail of malpractice insurance so that if any malpractice suits come up, you're covered by the tail, right? There's a signing bonus or paying off an education debt. Some programs will offer you a signing bonus. I think last year our signing bonuses for some of our junior faculty was $30,000. Just boom, there you go. They cover a lot of moving and relocation expenses, right? So if you're moving halfway across the country or something, a lot of the jobs will offer you and cover your moving expenses. Some of them will have non-compete and escape clauses. And what are those? Some of them will say, well, if you stay within a certain amount period of the job, but you leave, then you cannot take a job within a certain mile radius at the institution. And they're all, there's such a variety of different non-compete escape clauses, and perhaps Wynn and Lindsay can fill us in with some of what they've seen. Obviously, paid vacation, personal time. Work environment is a very important thing to consider too. Again, you need to sort of figure out what the nature of the practice is. Is it academic? Is it community? Is it hybrid? Is it going to be all endocrine? Is it going to be general surgery and endocrine? These are all things you want to think about. You want to think about like the patient population. Some jobs will you be working a lot in the VA? Is it a public hospital, private? What's the on-call schedule? Are you going to be taking general surgery call? Some practices require you not to take general surgery call. You want to make sure that you want to get an idea of what the practice is like. Colleagues, what's the morale of the practice? Is there stability? Are people leaving? You want to get an idea of that too as well. Does the practice have support like mid-level providers like PAs or ARNPs? If it's an academic institution, do you have trainees and medical students? You want to see if the practice will provide capital expenditures. Let's say you want to start an RFA service line. Are they going to provide you with that financial support? And finally, is it going to be a place where there are going to be some teaching and research opportunities if that's something that you're really interested in doing too as well? So let's see here. So you're evaluating the job offers. Again, you're going over the pros and cons. You have your mentors, talk to your mentors, those individuals who are not shareholders. You may, and I think again, you may want to talk to people who may have left the institution. They may give you some good insight about the job that you're considering. The other thing is, what about your peers? What are they doing? In fact, you guys are like a select group. You guys can, if you wanted to, you could probably put a monopoly on like jobs for endocrine surgery. You want to talk to them and see what they're doing as well. And in one sense, you're actually creating the market for yourselves. There's maybe 20 of you every year going out looking for jobs. So in one sense, you kind of know what the whole situation is out there. When you take these jobs or you're made an offer, you want to consider why you shouldn't take the job, right? And then also, again, compare it to your other options. What else is out there? Get advice. You want to sleep on it. So once you finally think through the whole thing, you want to seal the deal. When you're looking at an academic position, usually what they do is they give you a term sheet. And the term sheet usually is a reflection of things you've discussed, things that you want, things that you don't want, and you put it in a term sheet. And that's like the informal agreement that you have a deal. And then what happens then, it goes through and they make a formal offer with an institutional contract, right? So like, for instance, one of my associates that we hired 2-3 years ago, they wanted to be given a title for, to be a director of neuroendocrine tumors. So that was something that was negotiated. The term sheet said that this was one of the conditions that she wanted. It was put on the offer letter and it was put in the institution contract. It was written there and then she signed off on it, right? In community practice, it's a little more, they have kind of contracts. Again, you can add things to those contracts. Industry is kind of like that too as well. Again, when you finally get that offer letter or that contract, you should go over, with your fellowship director or mentor, trusted colleague, and other endocrine surgeons if you know them, to see if you think it's a good deal, if it's a good offer. And then there's always this question: should you have it reviewed by a lawyer or an accountant? I think that when I was going through the whole process, everyone said you should always have a lawyer to look it over. But I think over the years, what I've seen is it really doesn't add much to it. I don't think the contracts, the offer letters are really like, deceiving and they're trying to really get you on anything. But if, again, if you want an accountant or a lawyer to look over it, that's up to you. But I don't think it's essential. I think that kind of a lot of the contracts and offer letters out there are pretty standard. Last thing I would say though is this is if it's not in the offer letter or contract, don't expect it. You sign off and they tell you things that they're going to give you, but once you sign the contract and you start working, really they don't really you'll find that a lot of these things will not happen, right? So important thing to do is there are some non-negotiable things, as I said before. Those guarantees need to be in writing before you start, right? If you do that, it's written, it's down on the letter and the contract, and that's something that you have. Without trust, you should really reconsider the position. It's very important. So just quick summary, start your career planning early during your fellowship. I think you've heard that from all of us. You want to conduct an honest self-assessment with realistic goals, okay? You want to proactively seek and create professional opportunities, network, right? Network, network, network. You want to evaluate job roles, responsibilities, organizational fit. You want to see if they are compatible with what you want. You want to effectively communicate your value to potential employers. You want to practice your interviews, make sure you have certain things you want to make sure that these employers know. And you want to negotiate strategically to secure your ideal position. So thank you. And I know we're going to leave this open to questions.
Yeah, thank you so much, Sean and Lindsay. Let's open it up to all of y'all. And it's always hard for yeah. Can you stop the share and then we can get everyone on the screen? It's hard to be the first person, but certainly this is I mean, I want you to get the sense that all of your AAES members and your ESU faculty and all the people you're interacting with in the field are your resources, and it should be a pretty hopefully safe and comforting environment to ask questions. So anyone have thoughts or questions that they like to put out there? And yeah, maybe stop the share, John, so that way.
Yeah, I'm trying. Yeah, I'm going to do that right now here. Um, is it still up there or?
Yeah, it's still up, unfortunately.
I'm sorry. Here, let me try to see if I can get this off here, boss.
Anyone want to raise a hand or shout it out or put it in the chat, please? Oh, I see. Hey,
I've got a
Peter.
question. Yes. So Lindsay, this may be for you. I don't know Dr. Liu or Dr. Shen's like original job, but you mentioned how you wanted an endocrine only job to start with. And I know some places require like endocrine surgeons to take general surgery call. Is that something you've considered, or have you encountered other people that start with an endocrine only job and then have to like consider switching to take general surgery call later in their career? Like, has that ever happened, and how have
I
people navigated that if so?
so my job is endocrine only electively. I do take general surgery call. I really wish I did not, but I do. It's something that I really hope that over the next few years I can ultimately negotiate that out. But kind of speaking to what a lot of Dr. Liu just sort of discussed, there's a whole institutional culture, and to some degree, you have to do things that kind of fit within that framework. Um, I think it'd be very hard if you were not doing any general surgery to want, not necessarily to want, but to like feel confident and comfortable to go back and do a lot of general surgery. And I also think an institution would be a little bit hard pressed to hire somebody who has not done a lot of it and to sort of just be like, go for it. We're all, we are all, or we will all be board certified in general surgery, but I think we know that and feeling comfortable in practice are two different things. I think the farther out you get from doing a lot of these things, the less you feel comfortable with them. And again, I take general surgery call now at our main hospital, and it is insane. But like in some ways, I actually feel more comfortable being there than I would if I were at like one of our smaller ancillary hospitals because I have an in-house trauma attending. So if I have any questions or concerns, there's somebody available to assist. And so I actually feel more comfortable there. But again, the farther out I get and the less things I do, the more I think I shouldn't be doing this. I had to count up my cases for the last few years when I applied to do the FPD recently. And, I was able to count them up, and I've done like more gram patches than I have done like appendectomies in the last like 3 years, which is weird. But my point is, it's like you stop doing things all the time, and you just really at some point shouldn't be doing things. And so I think it'd be really hard pressed for you as a surgeon who suddenly feels really comfortable and confident doing all these complex endocrine things to be like, yeah, I want to take on some complex hernia repairs, so I don't think people tend to go that direction as much. And I also
Yeah.
want to say, like, I now I'm 7 years out, and I'm getting to the point of being like, do I want to keep doing all these crazy cases? And I think right now the answer is yes, but I can see why people want to stop like doing crazy, crazy cases as they progress in their practice, because you're like, do I need this stress in my life? So.
Yeah, John, did you want to comment
Yeah,
on
no, I
the
think, yeah. I think in some situations when you're hired, you're like the first endocrine surgeon in the area. And so a lot of times you'll be brought on first to do some general surgery in the process of building up your practice. And as you become more and more busier and you find that, your practice has grown so much, a lot of my previous fellows have said that after 3, 4, 5 years, they become so busy that they sort of wean down on the general surgery call, right? I think also things have changed a little bit at some of the big institutions in the United States where there's really now, when I started 20 years ago, there's maybe one endocrine fellowship trained endocrine surgeon institution, right? Now you're starting to see divisions of endocrine surgery or really big sections of endocrine surgery. So when you get hired in a situation like that, the general surgery call becomes more secondary because there's some divisions that really don't have that kind of call. They don't need to do the general surgery call because the volume is so high. So when I started out here, I did take general surgery call, but then 10 years after, we dropped general surgery call because our volumes were so, high. So now in our division of endocrine surgery here at Miami, we don't take general surgery call. We just cover our own service for all the endocrine surgery patients, right? So there are all these different kinds of setups, I think, and it's evolving, I think. And so, but generally speaking, a lot of times when people are starting out in a job, especially when they're the only endocrine surgeon, I'm sorry, it's like they probably have to do little general surgery to ramp it up. And then there's this a lot of my fellows now that are like maybe 7, 8 years into practice now are all 100% endocrine surgery, and they don't really take general surgery call because they can really sustain their practice by just doing endocrine surgery patients. So in the beginning, you may have to do a little general surgery in some circumstances, but I think it's something that later on can be sort of negotiated out.
Yeah, first of all, big comment. We're at 8:30, but I do want to keep going for a little bit because I think there's there's such a great opportunity to keep this dialogue going. So if anyone has to get off, that's totally fine, and we'll record this. Just to comment, just to add on to what John and Lindsay just said, I think it depends on the circumstance. And you're right, John. If you join like an established practice, then it's probably less likely you're going to have to do it. But I think in certain institutions, that's the way you're going to kind of achieve some credibility and get to know people. And then, there's always these stories of like, once you kind of start doing a good job on certain, general surgery type cases, take out someone's gallbladder or do some emergency appendectomy or whatever, then you can talk to either the referring providers or some of the other people in the institution and say, hey, listen, I also do thyroid, parathyroid, adrenal, et cetera. And they see you've done a good job with something like a general surgery case. And then they kind of tack on and build your referral pattern in the endocrine side. And yeah, sometimes it is the way to pay the bills while you're kind of building your endocrine surgery stuff as well. So I definitely would say be open to that possibility. Don't look upon it as like the only goal is to be 100% endocrine. I mean, I know of actually several endocrine surgeons who have moved on to higher levels in their professional career, but still do some general surgery just to kind of, keep those skills up and also just to be a part of whatever their department or their community is. But you're right, Lindsay, that it can also be very, very stressful. Other questions? Someone's got to have something. Come on. Sarah.
Yeah, I guess one of the things I've been thinking about is I can make my list of priorities, or I've made my list of priorities as to what type of a job I want. And I can imagine like what that dream job would look like. But I'm finally out of this era of there's a match. And so if I start applying for jobs now that maybe aren't that like perfect or ideal job and get an offer that isn't kind of that perfect fit, how do I navigate that versus waiting for later in the year where there may be a job that's like closer to that perfect fit? Right? The difference between having two job offers at the same time versus it'll kind of be rolling throughout the year. And maybe that's a very hard question that has no answers, but I'm kind of curious what you think about how you navigate that.
I would say I think the process takes a really long time. So just to, and not because I don't think it's possible for you to have an offer once and then have an offer later. I just think that the process takes such a long time that I think that's a little bit unlikely. But I think it goes back to, again, figuring out your priorities in terms of what you really want. And if a job is not right for you, then you probably shouldn't take the job unless it's that or having no job. Um, it's a little bit of a luxury to say that. I mean, I only had one job offer, so I'm not certainly not over here being like, just decline if it's not the right job. Like I would have taken like really at some point any job, but I think all the things that Dr. Lu talked about in terms of like an institutional culture and how things work and how, will you be successful there? I think that's all important to take into consideration. That said, so if you go and you feel like this is a good place and maybe this isn't exactly everything I wanted, but this is a great place for me to start, that's fine. One thing that I think neither of us talked about is the fact that 50% of people leave their jobs within 5 years. And so you agreeing to go to one place to work is not you signing up to spend the rest of your life there. And if it ultimately does not work, you can and should move. I'm not saying that's easy, but you have the opportunity to leave and find yourself another job. So
I would say, along with that, academic jobs tend to take longer, right? I think if you're going through a headhunter and you're looking for a community health system kind of thing, the offers are quicker. Over the years, I've seen that if fellows are looking for community jobs, the jobs come out really quick. Offers come up really quick. The academic jobs take a little longer, and a lot of times, even when they're looking at an academic job, they probably won't start till later in the year after they've graduated, actually. So the time frames are kind of like that. And then also, you take that into consideration. I've had some fellows where they've been given a job very quickly, and the pressure is to make a yes or no answer. And then the fellows are like trying to decide on another job offer, right? And there's a different kind of pace how these jobs are being offered. So there are differences between like academic jobs or hybrid jobs versus community jobs. So you take that into consideration too.
You had mentioned, starting to email people now. What I found, because I emailed a few places that had job listings. I'll just say, like, for example, like Northwestern, they had a job opening on AES, but they were looking for more um associate professor. That's who they were interviewing. And they're like, oh, well, we might have a job next year in August, but they don't really know yet. Same like UNC is working on hiring their chair of, like, there's a lot of other factors that go into it. And like, is there a too early for some of these specifically academic places where they're probably not going to know right now if they're going to hire someone in August of 2026?
So Hope, I would still use that as so things just happen through the year. Keep in contact with these places because you never know something could open up. You've established a relationship with that place, right? They know who you are. And things move, things come up. And if you're someone who's kind of in that realm, you kind of know that there's a position there. They know who you are. You never know. That could be an opportunity that kind of arises in time. It may not be right now, but maybe 6 months from now, maybe 8 months from now, maybe 10 months from now, something will become more, you know, tangible, more real. And then there you go. In that situation, you sort of have a head start, right? But it's not don't think of it like you need to get the job now. Even establishing some kind of relationship with that institution or people, very important because in 8, 10 months from now, things start opening up, right? And the good thing is you've already been in contact with them. And maybe later in the year you'll meet them at a meeting, right? Or something will happen. So, definitely those are important things to sort of establish now and still hold on to them because things do open up, right?
Other questions?
Have you found that departments are pretty forthcoming with what they're looking for in a candidate? I've been advised that it's helpful to present kind of a clear picture of, what you want, what your goals are, but there is flexibility and you wouldn't want to like prematurely close doors if what you're looking for isn't exactly what they're looking for. So I'm just wondering how specific, different jobs are in terms of what they're looking for and what sort of flexibility there is.
That's a really good question, Caitlin. So, like for instance, in the past 3 years here, Miami has opened up a lot of these satellites, and they've wanted to promote endocrine surgery service lines. So when we put up job offers, we want people that, obviously we want people to sort of establish a practice at these places, right? So, again, we're looking for an endocrine surgeon. We're talking a lot of it's going to be an ambulatory practice. There is an educational component. So you put it all out there. And so, when we're looking for people, obviously we look for people who are fellowship trained. We want people who are board certified, people who are people that want to have like an ambulatory practice in one sense, with the opportunity also to do some teaching, maybe some clinical research as well. So, I mean, I think that a lot of the programs or departments do have certain things they're looking for, right? In this instance, they're saying we need someone to come in and do clinical work and to build a service line at these satellites. So you read that, and that's kind of something that you sort of say, okay, I can do this. I'm fellowship trained. I have this experience, operating and doing ambulatory surgeries. So there are certain things that these places do sort of advertise. They are looking for certain things, all right? And so again, if that's something that you're willing to do, maybe you're thinking, well, I really want to spend more time doing this and maybe not at at a satellite. Well, that's something that you sort of decide if that's what you want or not.
Other thoughts or questions from anyone?
I have a question. What's like the average number of job that people apply to and like average interviews that people typically attend in a year? Like, are we cold emailing like 5 programs at a time, 4 programs at a time, and just quoting the responses or gauging how things are?
So I think that's a really hard, I don't think there's a number. And I don't think anyone knows that number, kind of going back to what I talked about earlier, which is that everyone is going to be doing different things. So again, I only wanted to be in Philadelphia, and I literally emailed every department chair in the greater Philadelphia area that was academic. And I thought was after that, if I really needed to go to like a community-based health system, I would. But I emailed 7 programs or something and initially got nothing. And then kind of later on through some other like connections, I ultimately got the offer to interview at Temple for a job that did not exist. And I interviewed there. And then they were like, never mind, that job doesn't really exist. Like, we don't have the room for you. And then somebody later on left, and then the job opened back up. In the meantime, I was interviewing for a job at Drexel, which also didn't really exist, but the chair was like interested in growing that way and was, had all these kind of like a little bit crazy ideas, and that hospital no longer exists right now. So that worked out fine. But my point is, I only applied to like 7 jobs that didn't exist, sent 7 cold emails, and all in the end interviewed at 2 places and had 1 offer. One of my residents who just graduated endocrine surgery fellowship, and he's starting as faculty in Kentucky, and I can't remember if it's Louisville or Lexington, but he went to a number of interviews this spring for established jobs. And so I don't even know the total number, but it's just a very different process. He had a lot of geographic flexibility because his family was going with him. He just wanted to find like an endocrine only job. So he did a lot more of that. I think there were a lot more jobs available this year. So again, there's no one number. This is the opposite of when everyone's like, oh, how many residency programs do you apply to in order to get a certain number of interviews? There's no one number because again, some people, when I was a fellow, there were only two of us from my fellowship year who went into academic endocrine, which is not saying that that's the gold standard or what everyone should want to do, but just as an example, there's only two of us. So everyone else was looking for other things. They wanted non-academic. They wanted some mostly general surgery and some endocrine, right? And so people are going to look for different things and interview for different things and apply for different things.
Yeah, I would agree with you, Lindsay. I think it is quite variable said, and everyone's going to be slightly different depending on, the market that year, and then also the opportunities that they're specifically seeking out, and then geography and things like that.
Yeah, I would echo both of them. I think that a lot has to do with you, right? What you want, right? I've had some fellows that have said, I either want to be in New York or LA. And if there are no jobs available there, then there are no jobs in endocrine surgery. But it was a year where actually there were a lot of jobs throughout the country. It's just that they didn't want to be anywhere else, right? So that was part of it too. I always recommend, cast a wide net, right? I think there are jobs out there. The question is whether or not it's a location or a place you want to be, right? There are a lot of jobs out there. It's just the thing is, does it really fit you? That's why if you listen to our presentations, a lot has to be a personal decision on your behalf, right? What's important to you, what you're looking for, and then from there, whatever jobs are out there, I think a lot is driven by that. So I do think there are opportunities out there. I think, but a lot of this is a personal choice, right? What you want to do, where you want to be, things like that. So I think that's a really important part of this whole process, I think.
Other questions or thoughts? Okay. Any thoughts to wrap things up, Lindsay or John? I think you kind of did a nice job of summarizing, but did you have anything else you wanted to say?
No, just that again, it's hopefully this is helpful and provide a little bit of a framework. It's just that the process is going to be so individual and it's so foreign from what anything you've done before, and that's okay. Again, there's no standard timeline, no standard expectations, etc. Just again, follow your heart about what you think is the right job for you. Nothing is for life, and you're going to have a great career. And sometimes it might be your first job is where you end up forever, and sometimes you'll have to move around for it. But just it's very unsettling going from the structure that you've had to this, and know that you're not alone.
Yes, definitely. And feel free to reach out to all the different resources that you have within the AAES and within the ESU community. Yes, I would definitely echo what you said there, Lindsay. And I would also say, make sure just to also do a good job with your fellowship and enjoy your fellowship, right? Because you don't want to have your entire kind of psyche dominated by what's next, what's next, what next, and then lose out on the opportunity right in front of you. So definitely do a good job with your fellowship, enjoy it, really immerse yourself because this is your opportunity to like really, really, learn and experience and start planning for what's next, but in a protected environment. And so don't let any kind of anxiety about the future kind of mess with with the incredible opportunity you have for this year. John, did you want to wrap up with anything?
So you all have fellowship directors, and the nice thing about the endocrine surgery world is there's a great esprit de corps, right? There's not, I mean, everybody knows everyone. And so, I would just encourage you, talk to your fellowship director, talk to the people in the AS. I mean, it's a nice esprit de corps among everybody. I think that you can make network connections, things like that. So, and the nice thing is, we all know each other. And so it's not like you're talking to strangers a lot of times. So definitely use those resources. It's a very nice, it's a really nice organization.
All right. Well, we went way over time, but I think it was worth it. And I really want to thank John and Lindsay for your time and your insights and your wisdom. For the fellows, feel free to reach out to me anytime if you've got questions, any suggestions. We basically try to keep things, interactive and fun. And, I really do encourage you to ask questions of all our faculty and to participate in all these sessions. And definitely when we do the real ESU next spring. Our next planned webinar, we try to incorporate some neuroendocrine into the year because it's something that is so variable amongst the different programs. So we are going to have a neuroendocrine session, I believe, in November with Mary Beth Hughes, who's one of our core faculty, who has a talk about some of the didactic elements of neuroendocrine. Then we'll do some more case-based neuroendocrine during the actual ESU. And we've got Travis McKenzie here, who's going to be participating in that as well. So stay tuned for when that happens. The next webinar for that is usually an interesting cases session, and then we got some other cool opportunities to come with this with the coming year. So with that, everyone have a great night. Thanks for coming out for this. Thank you again to Lindsay and John, and see you at the next webinar. Thanks.